You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, extreme smile makeovers. According to my first guest, he says your teeth and gums are never too bad to have the smile you've always wanted, the smile of your dreams. With us, we have the go-to dentist in San Diego, Dr. Jordan Colby. Dr. Colby, welcome to the program.
Thank you so much. It's good to be here. I know we've been trying to connect for a while now.
I've been trying to get you in here for quite some time.
You're kind to keep being persistent.
And now you have a stack of photos, so we'll try to get to as many of those as possible.
Okay.
But for people that don't know your practice, I guess you have practices in Fallbrook and Oceanside. Who's the typical patient? I invited you on the show to talk about like these extreme smile makeovers today, full mouth reconstruction, I guess as dentists call it. But who's the typical patient you see?
So the cool thing about our practices is we try not to be so specific on who we're looking for. I mean, there's so many different variations of issues and medical histories. We try to accommodate anybody that is brave enough to walk through our doors.
Okay.
You know, going to the dentist is a scary thing. And of course, I didn't know that I always wanted to be a dentist, but I had a great dentist growing up. And so I had no anxiety associated with dentistry. But after graduating, it became very clear that the majority of Americans are scared and don't want to spend time in a dental office, right? So we try to do our very, very best to make it comfortable, happy, uplifting, a good experience, for heaven's sakes. And a lot of patients haven't had that. And so when they come in to see us, it's kind of like, they can just breathe and be like, this is a good place where I know I'm going to leave better off than when I came. So the cool thing about our office is we try to accommodate everybody, right? And we know that there's all kinds of backgrounds and medical history and gum disease and genetics play a role in that. So we try to accommodate anybody that comes through our door. Literally, if you come to our office, we'll find a way to help you get the exact result you want. And that's what makes me so excited about modern day dentistry, is we can do things in one day. One thing I realized when I was a young dentist was that the less often people had to see me, the more they liked me.
Is that right?
Yeah, and I didn't take that personally. It just means that they want it to be efficient, and they want to spend less money, and they want to see me once maybe and just be done with it, you know? Of course, they have to come back for cleanings, and that's important too. But we try to be efficient, and most things today we can do in one visit, which is just amazing.
Now you do everything like from general dentistry, cosmetic dentistry, root canals, I guess Invisalign,
so
implants. You do all those things.
Yeah, what's interesting is in dental school you have to be proficient in everything, every aspect of dentistry in order to graduate, right? But then a lot of dentists, when they graduate, they decide what they want to do specifically. Maybe I'm just get bored easy, but I love all aspects of dentistry, with it straightening teeth, fixing teeth that look bad, fixing bad breath. It keeps the job exciting, I guess, and it's fun because, you know, when you have a patient come in that says, I need this, this, and this, it's always saddened me to say, well, I can do this, but you got to go away for that. I felt like I was losing friends, you know, in a way.
You told me this on the phone.
Yeah.
That you wanted to learn additional skills, so because sending a patient out maybe to the root canal doctor,
right, is
like sending a friend away to another doctor.
Well, patients would ask me like, oh, Dr. Colby, can you do that here, please? They would almost like beg in a way, like, we don't want to, you know, it's a lot of anxiety to meet someone new, to drive to a new location. Where do you park? How do you get there? Am I going to be late? There's all these issues. Get time off. So to find a dental home where A to Z, anything that comes up, whether you're, you know, a young patient to your 90, we have some patients that are 99, you know, even over 100.
So 100-year-olds are doing this. Now, for these extreme smile makeovers that are coming in, like where you're kind of rebuilding their mouth, giving them a great smile, what are your older patients?
Yeah, so I don't like that word extreme. You know, nothing we do is extreme. We try to make it simple and as comfort as possible. And I think, I mean, all of our patients are amazed with how quick it happens and with as much comfort as possible. And yeah, we have patients over 100 years old. I think one of my oldest patients was 96, where we did her teeth in one day. You know, she had said the cutest thing to me. She said, "You're never too old to eat." And I guess for that matter, never too old to smile either.
That's good.
But yeah, you know, the older you get, obviously there's medical issues, and to be able to eat, to provide your body with the nutrients that it needs is even more important later in life, right?
So I was talking to an oral surgeon, knowing you're coming in. He was saying, Randy, there's this new breed of general dentist where they're doing everything Like they're like a super specialist, which isn't a recognized specialty.
Yeah.
But is that how you kind of consider yourself?
Yeah,
in a way?
so like I said, in dental school, before you can graduate or before you leave that door, they make sure that you're proficient in all aspects of dentistry. And so I just felt like that was a gift. And so to kind of just narrow it down to my one career and one specific skill just seemed not right to me. And I love the opportunity to say we can straighten your teeth when you're young, and as you get older, if you lose a tooth, we can replace that, and maybe if there's some genetics there in play, maybe they'll lose a lot of teeth, and we can fix that as well. But I just love the idea of like, when you come here, you don't have to leave unless you want to, right?
Okay.
But our goal is to make sure that people love it there, they tell their friends about it, and you only do that by taking good care of people, making it as comfortable as possible, and not dragging the procedure on for months. I mean, that's like my biggest pet peeve.
Now, I know you do dental implants for people that are either wearing dentures or people that it's been determined you got to remove all their teeth.
Right.
But today's topic, I want to invite you on for the people that aren't quite ready to lose all of their teeth.
Sure.
And correct me if I'm wrong here. So the way typical offices work, like if you need a root canal, you go to that doctor. If you've got gum problems, you go to the periodontist.
Yeah.
You need surgery, maybe you go to the oral surgeon. So at your office, you do it all right there. And again, you actually make teeth or print teeth right there on site.
Yeah.
Is that why you do things so quickly?
Yeah, we're certainly living in the most technologically advanced time of dentistry ever, right? I mean, the technology is unbelievable. And the cool thing about the education process in dentistry is after you graduate, you know the basics, right? But then you can take these amazing courses that allow you to learn surgical procedures, right? Allow you to learn how to straighten teeth. And so that allows us to really narrow in on what this specific person needs. Like I said, there's a lot of bone loss, right? Or gum infection or bad breath. And it gets complicated quickly. And so if you have to see one dentist per issue, you're going to be spending all week.
And does that happen?
Happens all the time, right? I mean, I just met a guy at Board and Brew, and he's missing a tooth. He asked me what I did. I was standing
sandwich place.
Yeah, the sandwich place. I was waiting in line for a sandwich. He just struck up conversation, which is great. And I told him I was a dentist. He's like, "Oh, I'm missing a tooth, And I said, "Well, how long have you been missing the tooth?" He said, "About 6 months. I'm just waiting for it to heal so I can get my implant." And I was struck. I was like, 6 months? Why are you waiting 6 months for a dental implant? Where nowadays we do that in one day.
So somebody walks in, you could remove the tooth and wait, or remove the tooth and give them a tooth that day.
Yeah, so what's amazing is the moment you lose a tooth, you start to lose bone. It starts to atrophy. It's like a muscle, right? When you don't work out a muscle, you're going to lose that mass. So as soon as you lose a tooth, it's the best day to put the implant in. Number one, the patient's already numb. They're already in your chair. They don't have to make a second visit. So pulling a tooth out and getting an implant in the same day is the best. Plus, it saves 6 months of healing and walking around with a missing tooth.
Did you hold it in?
Yeah, I said, I'm sorry to hear that, but we some offices like ours, we do it in one day. And he said, "What do you mean one day?" He actually didn't believe me because it sounds almost too good to be true. But when you think about the science, and when I can explain it, it does make a lot of sense. You lose a tooth, you get one back, the same day, and you should. All
right, now you brought photos. What are we looking at over
here? So let's talk about some before and after photos. These are wonderful patients of ours, and this is a lovely lady. Over the years, she struggled with gum disease, tooth disease, bone infection.
So what is gum disease?
So you start to accumulate bacteria inside the gum tissue. And if it sits there for too long, right underneath the gums, you have your bone. And so that bacteria can go from the gums to the bone, and as that bone goes down, I've seen pristine teeth that no cavity, but because the bone loss, it becomes wiggly, right? And it's very
because of the bacterial infection.
Yeah, and we can get into the systemic implications for infection, right? There's a whole laundry list of issues, but it's really sad to lose a tooth that is otherwise healthy, but because the foundation is not good, you're going to lose it. So there's three things, right? She had gum disease, she had bone infection, right, and tooth decay, right? So cavities in the teeth. So
is it just from lack of brushing your teeth?
She's such a sweet lady. There are a lot of genetic implications, just meaning that, if your parents or sisters and brothers had dental issues, there's a higher chance that you might too. So not all these patients most of them are not neglect. It's just genetically that's the case. And also, there's a lot of anxiety, right? She was super anxious about going in. She had a bad experience when she was a kid, which is very common. And so she's like, I don't want to spend the money. I don't want to spend the time meeting somebody. I don't want to get hurt. Who wants to spend money to get hurt?
They tell you this on the consult?
Yeah.
Okay.
Yeah, and I mean, bless her heart, we try really hard to share our message about who we are, just to give people the confidence to come in. We try not to charge them a penny. It's a free consultation. Just come and meet the team. and see what we can do. And so she has 3 major things going on. How do you address all 3 things? That could mean going to 3 different offices. But in this procedure that we do, we keep it super simple, and we're able to address every single issue in one day and in one single visit. And when she heard that, she was like, I mean, I can't believe it, number 1. But number 2, like, how do we start? I mean, if this is true, let's do it. So here's her after photo, and it's really a sweet, one thing I love about taking photos is that it's hard to hide how you really feel in a photo. And you can see from this after photo, she's gleaming. Would you say she looks happier?
For sure. Yeah.
Right? Would you say she looks more confident?
Yeah. Yeah.
Would you say she looks maybe younger?
Definitely younger.
Right?
Looks like a different person in a way.
So on her before picture, it was even hard for her to allow me to take that photo. And we have to take that photo so I can design her perfect smile. So I have to see where her lip goes and where the teeth are. And usually when she would laugh or she would cover her smile. I mean, she didn't even smile before. And now the after photo, you can see there's no restraint on her smile. She's going to give it to anybody, any day. And I think in this world today, we need more smiles. So when you have bad teeth like this, there's a lot of foods you can't eat. And it's kind of interesting subconsciously.
Like what?
Like celery or carrots or a hamburger, right? Or a sandwich. And subconsciously your diet shifts. And a lot of these people don't even realize that their whole diet has shifted just because it gives them pain or whatever. And their whole diet shifts without them even realizing it. Years later they go, man, I used to like to eat sandwiches or hamburgers or steaks or vegetables, and now I just eat oatmeal or smoothies or something like that. So restoring her back to how her teeth were originally, revitalized her completely.
Now, I know at the top of the show, I called it extreme smile makeovers. You don't like extreme. You say we don't do extreme. But in a way it is, because she looks different.
Yeah.
Now, what does she like more? What is, I guess in general, if you had to generalize, do they like the way their teeth look, or do they like what they could eat?
Yeah, so it's so fascinating, right? Everybody's so different. And some people will just come in because they want to eat. Other people will come in because they want to smile. Other people come in because they want to kiss their partner, right? There's an intimacy there that is not really allowed when you have bad breath, or maybe you're just embarrassed of opening your mouth. You can't kiss somebody. So, a lot of people do suffer from being self-conscious about their breath, right? And it's very simple. It's just bacteria. Bacteria
so
causes...
from the infection.
Yeah. So bacteria creates gas, period.
Okay.
And so that gas is in your mouth, and when you open it, you can smell it.
How soon does that go away?
The smelliness?
Yeah.
Yeah. What's so cool about this procedure, and it's my favorite thing, and it's what gets me up in the morning, it's what I get so excited about, is it's the same day. I can't tell you how therapeutic it is to remove infection, right, from the bone, from the gums, and from the teeth. The moment it's gone out of the body, in that moment, they're healed from that disease.
Okay.
And so then when they're done with this and they wake up and we give them a mirror, it's an emotional eruption.
Like?
It's an emotional eruption of tears and hugs and joy. And it's a whole new level of euphoria that you get addicted to in helping somebody. And that's honestly the reason why I wanted to be a dentist, was to help one-on-one individuals. She has a story. She has kids. She has grandkids. She has a job. This doesn't just affect her smile, right? It affects her entire life.
Now, you were saying that all of these patients have regrets that they didn't do this earlier. Is there truth to that?
Yeah. There's no bad time to do it. But because of that anxiety and the unknown is so daunting, it prevents people from taking that step.
Now, what about sedation? Because it's, dentistry hurts, especially these big kind of procedures.
Yeah, like I said before, I learned early on, the less they have to see me, the happier they are.
Okay.
And the less they feel, the happier they are. So doing things in one visit, they just got to see me once, right? And the second thing is, if we can reduce that pain level, and when you're sedated, you come in, you're sedated, and when you're done, you wake up. A lot of patients will ask, are we going to start soon? And I say, you're already done.
Is that right?
Yeah, which is cool.
So you could, somebody watching this with bad teeth, bad gums, whatever, if you had an opening in your schedule, the day after tomorrow, they could have this new smile.
Yeah, and it's always...
Is that an overstatement?
Yeah, it's good to meet them first, right?
Yeah,
we always like to meet them, and we'll take x-rays for free as well, and see what their goals are. So the thing that I love about our practice is that we have a variety of a range of treatments that we do for patients. It's not just one thing, right? There's a lot of practices that just do dental implants, and if you go to that dental office, you're going to get a dental implant. And that's great if it's needed, but we look at the whole picture and we want to say, well, if we can save it, let's save it. And it's more important about what the patient wants, right? Because I don't want to force anyone to do something they don't want to do. But if they want to try to save a tooth, let's do it. If they want to remove it, and like this lady that we just showed you, if they want to have a different life with no gum disease, no dental infection, and no bone disease, let's do it. And so it's up to the patient to kind of direct us.
So it's a combination of procedures.
Absolutely.
You confided in me in the green room that you see where patients, they're removing teeth that are, in some cases, healthy, that you could have saved.
Right.
And that losing teeth is expensive.
Yeah, we do second opinions all the time, right? Patients will come in with a combination of situations, right? Gum disease, bone disease, tooth infection, and they were told by previous dentists that everything had to come out. And that's an opinion, for sure. And that's an option, but there's always 2 or 3 other options. And so I love so much to say, what do you want? What is important to you as the patient? And if we can help you achieve that, I'm 100% on board, and we do it all in-house. You don't have to go to 3 offices to do that one goal.
Now, you teach other dentists some of these complex procedures.
Yeah. So I have a course that we run that we teach dentists who are getting interested in placing dental implants, doing a full mouth situation. I'm lucky enough to be able to teach that to them, yeah. So let's go to our next patient.
All right.
This gentleman, this is a pretty cool story. So this patient came in, I met him years ago. We did a couple single teeth procedures like a crown and a filling. 3 years later, he came in and he lost his front tooth, as you can see here, a couple front teeth. And he goes, I'm just so tired of doing one tooth at a time. I know that these are bad. My dad lost his teeth. And so he kind of saw the writing on the wall, right, where this was going. And so he wanted to see what we could do. And so through a combination of procedures, right, we were able to...
Let's take a look.
Yeah, let's see the after photo.
Very nice.
Yeah, and it turned out great. What I love so much too about these teeth is some patients come in and they want the widest smile possible. And it looks good on some people, right? Maybe Ross from Friends, right? He's glowing in the dark.
Yeah.
But for most people, we want it to look natural. We want you to walk out of the office and not have anybody know that anything was done to your teeth per se. You just look happier, you look brighter. That's the goal. We want it to look natural so you can just smile.
Too.
Yeah.
I'm not trying to side with you, but he does.
Yeah, I think, there's just a complete shift, really, in the paradigm of his life.
Do you ever have patients say that, like, hey, doc, you've changed my life?
Yeah, we definitely do. But, really, he changed his own life. He's the one that made the decision to come in, to get a consultation, see what he could do. He had grandkids that he would hug, and they would say, Grandpa, don't hug me because your teeth were scary. And now they don't even think about it, right? I mean, teeth are working best when you don't even know they're there. You can eat what you want. You can smile. There's no reservation.
Okay, good. Time for a few more.
All right. So next one, she's very sweet. This patient, she had seen a lot of different dentists. A lot of different dentists said there was no hope. She didn't like her gummy smile. So when she smiles, you can see a lot of her gums. And
that's got to be unusual.
So it's actually not that unusual. A lot of these patients don't smile or they hide their smile. I mean, they love COVID because they had to wear a mask. They were covering their smile. So we see it quite a lot, and it can be very complicated to fix. But in this method where we do teeth in a day, it just simplifies it. And there's a lot of beauty in just simplified
Do you have to laser
treatment.
the gums? I mean, how do you take the gums away?
I can't tell you all the answers. I can't give you...
We got secrets.
Yeah. We have to keep it, we can't tell you everything. We got to kill you if we do that.
Okay.
So, but I want to show you the after photo because you're going to see, I'm like, she could be, Oprah Winfrey, She has a beautiful, radiant smile. She's a completely different person. It was really sweet. Her husband brought her in. And he said, I want you to just make her smile the best possible. And
That's a big change.
That's a big change.
What do they say? Like, what does somebody like this say when it's all done?
But she's so sweet. She speaks Spanish. One of my favorite things to do is speak Spanish.
You speak Spanish?
Yeah, I majored in Spanish in college. I lived in South America for a couple of years. And so it was such a sweet moment to be able to connect with her in Spanish. And she just kept telling me like, me quieres los dientes. Like, what
does that mean?
So it's like, I just love my teeth so much, she's like, ahora sí puedo sonreír, it's like I can smile now. And so, as a dental professional, I just will never realize what an effect it has on their life, right? I mean, one thing to smile and eat, but it goes so much farther than that. And she really helped me understand that.
Now, you say patients feel judged when they have bad teeth.
Yeah, unfortunately, in our country especially, we do judge other people with their teeth, and we probably shouldn't do that, but the way that they speak, you think about when you're speaking, your tongue is hitting your teeth. And if they're positioned in a bad way, maybe you have a lisp, right? When you smile,
is that right? Okay.
Yeah, maybe your lip catches your teeth when you smile, right? Because if they're not straight and if they're awkwardly shaped, they could it's just you're going to speak different, you're going to smile differently. And so unfortunately that does go into some judgment.
We were talking about this, like in the movies.
Yeah.
Like if they want to make somebody look poor, they give them bad teeth.
Right, yeah. And it's just like an automatic thing in our country where we just make these quick judgments within 60 seconds.
So
you make
this
a
goes
judgment
away
call.
in one day.
Yeah, our goal is just to remove that. I mean, there's so
Okay.
much more to a person, obviously, than their teeth and the way that they look. Let's just remove that so that we can maybe get to know the person a little better and be less judgmental. So this next photo, she's very sweet. She was one where when I literally met her, she had a hand in front of her mouth.
All right.
She would speak to me with her hand in front of her mouth. And so I had to ask her nicely to give me this picture so we can start designing her smile. And you can see what a difference it makes to just have a full set of teeth.
That
right?
is a big difference.
Yeah, I mean, it changes her completely. Now she can...
Do they come in with like low expectations? Like they don't know it's going to be this good? Because when you were showing them before, I didn't see the after yet.
Yeah, you know, when I was a student, I also was kind of reserved, like, can it really be this good? But now that we've been doing it, you know, for 10 years, we are full of confidence, and we know when they come in, we know that they're going to be blown away.
Can you see it? Like you're talking to them, hearing their hard luck story, and you're going, boy, this is going to be good.
Yeah, and patients say to me all the time, I'm probably not a candidate. I lost a lot of bone. My previous dentist said I have, you know, gum disease, bone disease. I'm losing my jawbone, and they say to me, I'm probably not a candidate. And so I sort of smirk, you know, and think to myself, like, you have no idea what's possible today with almost no bone. I just love that, you know, the patients, they don't know what you don't know. So they come in, they assume, Dr. Colby, you've probably never seen a case like this. And of course, that could never be true. You know, doing this for 10 years, we've almost seen it all. But if you're healthy enough to come into the office, there's something we can do
Usually something
to help
you
you.
can do.
And patients have, you know, osteoporosis, right? Their bones are shrinking. The cool thing about the mouth is there's so much blood in our face. The bone stays very, very healthy, even though maybe the joints have arthritis. There's just so much more vitality in the mouth where we can actually, I mean, you know, do something that's way beyond what they even thought possible.
Now in dentistry, I guess the dental term is full mouth reconstruction, full mouth rehabilitation.
Yeah, and I hate all those terminology.
That's what you told me.
I hate all that stuff.
Why?
Because people don't understand what you're talking about.
Okay,
You know,
okay.
but when I meet somebody and I say, you know, there's this going on, we can fix it all in one day. And that's all they care about. They just want to have teeth that they can chew, that they can smile, they can kiss their partner. They just want to have teeth. And that's all possible in one visit.
I know you have a lot more photos, and you wanted to show them,
Yeah.
so I'll rush you a little bit.
Yeah. Okay, so this gentleman's awesome. He actually found us. He's from Thailand, and I don't know how he found us, but he flew in, he did a ton of research. He came to our office, and he was expecting me to say, they all got to go, and you got to get a full denture.
Okay.
A full denture is a bad word in our
he want a
office.
denture?
He wanted, well, he thought it was his only option, right?
Okay.
So a full denture is basically a prosthetic. It's a loose prosthetic. If you lose a limb and you get a prosthetic that connects, a denture doesn't connect to anything. It's a loose
You don't like
teeth.
dentures.
It's a loose.
I know a couple denture wearers. They never complain.
They don't complain to you, but
Okay,
they're
that's a
never
good point.
happy.
Okay,
They're
okay,
never
okay.
happy. They have to
That's
use
fair.
glue and it's loose. You know, he thought a denture was his only option, right? And you can see from his after photo, you know, having teeth that he's able to eat whatever he wants and he doesn't have to worry about taking them out.
That was like one day?
One day.
Was that like a lot of pressure? Guy flies in from Thailand
you know,
with a lot of dental problems?
Yeah, it's interesting because I used to shadow dentists that were doing these, and I would think the same thing, like they're probably really nervous to do this. But once you've been doing it for so long and you have the education and you're teaching other people, it becomes as easy as tying a shoe, right? For the dental team, right? Because they're so
it's
dynamic.
easy for you, technically demanding.
Yeah.
But for the patient, they just get sedated. Next thing you know, they got good
Yeah,
new
I mean,
teeth.
waking up with a smile like that from where he came from, I mean, I'm hoping we get his friends in Thailand because he's going to go back smiling that big and not covering his smile like before, right? So I know you.
Yeah, we got about a minute left.
All right.
This is
so
good, though.
this lady's so sweet. She came in, she's missing a bunch of teeth. So this is one of those patients, you know, they do a ton of research beforehand. She wanted the best case scenario because she's a great cook. Turns out she cooks a ton of food for her family and she loves to eat. And she's like, doctor, I can't eat. I can't eat the foods I'm cooking, which is devastating. You got to try the food you're cooking. So she wanted to have enough teeth that she could continue to enjoy the food. So I'll direct your attention to the after photo.
She's looking
you know,
good.
so this is sort of like beyond the smile. It's like the practical approach of,
Okay.
let me have a full set of teeth where I can eat without any restraint. And that was a result.
Now, in your office, for people just tuning in, so you're actually making and printing teeth right there in the next room.
Yeah.
Which allows you to do things very quickly. You've got all this technology.
Yes.
if they took your technology away and you had to be like 90% of the other dentists out there.
Yeah.
I think we joked about this in the green room.
Yeah.
It would be difficult?
Yeah, well, I've met, like I told you before, I met that patient at Board and Brew where he's waiting 6 to 7 months
To get one implant.
Yeah, to get a tooth. And with 3D printing, and the cool thing about that is, I always say that dentistry is the perfect combination of art, technology, and science, right? So we have to be an artist. You have to be able to create an artificial tooth that looks and feels real. That's not easy to do, but it's so much fun once you've mastered that ability, right? Because you don't know if those are fake or real, and they should look totally real.
Okay, good. So we're out of time. Final message to the patient. They've heard what you have to say. Really bad teeth and gums. They feel like there's nothing that could be done.
Yeah.
But they're still afraid. They've even heard what you have to say. What do you say to them?
Yeah, I mean, there's just no pressure, I think I'm always so impressed with patients that decide to just make the phone call, right?
Okay.
Or go online and fill out a little form that says, I'm interested in meeting your team. We want to meet you. We want to see what's happening. And then I think you'll be amazed. I know you'll be amazed at seeing what we can do in such a short amount of time. People spend years worrying, but in fact, you can have it all resolved in one single visit, which is amazing. It almost sounds too good to be true, but the technology that's allowed us to get here, I feel very blessed to be able to provide that service, because if I was a dentist 20 years ago, it's a totally different ballgame and it's a different life. And so it's lucky to be in a place where you can come in, meet a great team that just wants you to be happy and achieve your goals, not our goals.
Okay, good. I want to thank you for coming on the show. Now, if somebody wants to make an appointment, do they go online? Do you prefer that, or just call your office?
You can do whatever you feel more comfortable with. You can go online and fill out a form. You can email us. You can call us. We love talking to patients.
Do they see you on the consult?
Yes, they will. They'll meet me. We'll take free x-rays. It's just good to talk to them on the phone, too, because we can hear your story and see what's happening.
Okay. All right, Dr. Colby, I want to thank you for coming to the show. Good stuff.
My pleasure.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.